Excessive restraint and seclusion, lack of consistent treatment, and substandard conditions. These are just some of the claims against a treatment facility in southern Colorado. Parents who have sent their children to the center are sounding the alarm, warning others not to make the same mistake and find treatment elsewhere. Fox 1's Austin Sack breaks down these claims and what one protection and advocacy group recommends the center should do.
Rachel, Disability Law Colorado is behind the report detailing dangerous conditions at the Southern Peaks Residential Treatment Center in Canyon City. It's a licensed psychiatric residential treatment facility with a therapeutic designation from the Colorado Office of Behavioral Health. Now, for the last 3 years, Disability Law Colorado has monitored visits, interviewed with nearly 50 children, and gotten input from families, advocates, and staff before releasing its public report.
I feel bad. I feel bad for the kids who are still there and who are going there.
For the last 4.5 months, Jayla Hunt received mental health care at the Southern Peaks Regional Treatment Center in Canyon City, but Hunt says it's not too far off from the correctional facilities just up the road.
There was excessive restraints, long restraints for minuscule stuff. Having all those people on top of you is very scary.
And it's not just her experience. A new report from Disability Law Colorado, a protection and advocacy system, documents dangerous conditions at the center, which is one of only a handful of its kind in our state.
It needs to stop being run like a correctional facility. Just make it treatment.
The report says as of this past May, Southern Peaks staff frequently restrain children, an average of 70 times per month, with some kids even getting hurt in the process.
Those numbers are more equivalent to some of our youth detention facilities, but at least those that are similarly licensed as mental health treatment facilities, those numbers are high in our mind.
The report also claims a lack of consistent treatment and substandard conditions with metal beds, dark rooms, and raw or uncooked food.
The big issue is staffing. I think if we were talking about a facility with 12 or 20 beds, that's a lot different than a facility with 52 beds, and it requires a lot more staff.
Despite some improvements over the years, children describe the facility as the worst they've encountered.
I think that Southern Peaks put stuff on me that I didn't want or traumatized me more than I was when I went there.
Hunt returned home 2 weeks ago, and her mom says the healing journey never stops.
Jayla's mental health kind of stems back a couple years ago. Her father was murdered here in Colorado Springs, and so of course with any kiddo that's going to cause an element of trauma, and so we try to work through that with a couple different types of therapies like inpatient, outpatient, and we ultimately decided that residential treatment was best.
While Disability Law Colorado has another scheduled visit at the center and says our state's licensing agency is aware, both Jayla and her mom agree something needs to change.
These are kiddos who have experienced trauma or are neurodivergent in some capacity, and they need to be treated as patients and not criminals or inmates.
And now that I'm back, and thanks to the therapist I had, made it so much easier with family sessions and building a relationship with my family more.
Now, Fox 21 reached out to the center over a week ago, and we're still waiting to hear back. We've also heard from we plan to hear from 2 other impacted families, one who claims the center violated a state and federal charge when it abruptly kicked their child out. All of this shortly after the report was released and news coverage began. I'll unpack those claims in the coming days.